Welcome back, everyone, to another episode of the Now and Then podcast. I'm Dr. Bart. This is Callie.
Yes, we're excited for another week being here with some fun topics.
Yeah, a lot of health news this week. This is a week that I would say there's a lot of meat on the bone.
Yeah.
You know, a lot for our listeners to take away from this one. I'm excited, probably almost too much for some of these topics. This is grassroots of stuff like what can we do with this information if it's just out there as noise. So welcome back. Thank you for being here. And of course, we're going to do everything that we can with the news that comes in every week, figure out what's trending, what's timeless, and of course, what actually works here.
Oh, yeah.
So we get some big ones. So we're walking through the first one that we're going to jump into is the blood pressure thing.
Right.
This is, we go to the doctors, they tell us they've given us a standard of this should be your blood pressure. And now it looks like, and this is, I think, what we need to really clarify for our audience. Are they altering the number, or are they deciding to get a little bit more aggressive with when they start, I'm going to call it pushing the meds?
Right.
So big topic right there.
Big topic.
Yeah, and I'll be leaning on you tell us what the actual science says there. We know what actions they're taking. All right. The second one, very interesting as well. This is important for all of us. There's a gold standard out there when it comes to colon health in terms of cancer, and that is a colonoscopy.
Right.
And I believe typically they recommend about 40, 50 years of age, you typically will get your first one. But apparently the science that is recently, or the data that's recently been published, isn't necessarily gold standards.
Right. And it's taking what we'll talk about, 75-year-old studies and science that came out that hasn't really changed much. And now we're trying to say, does this make sense over the 75 years that this has been going? And the study that we'll talk about came out in May, and it followed 13 years. So it's not like it was a short one. It followed a lot of participants. So I think that one will be an eye-opening one, because a lot of people think, and I think it just opens a different conversation as well when it comes to scans and what are you looking for and going in and doing these things. So a lot of people, do their routine checkups. What could potentially be the other side of it?
And that, I think, is the most important part of that conversation.
Yep.
Is what is the new conversation? What is the new vibe when it comes to preventing things and also just being healthy as we move forward? Right. But it doesn't end there. Then we're going to go back to a conversation we've had several times. And I think that we should be continuously having these conversations about GLPs in the potential, or what I guess we're now seeing is, yes, people are losing muscle.
Right. And we've had that conversation already thus far. But I think it's just to continue to emphasize how these are tools that can be used, and they can be used well, but most people aren't using them well.
What I think we do with this one, we'll map out that whole conversation, but I think we map out for the audience our program.
100%.
That we use, and the very specific markers that we consider GLPs. Like, listen, we're not against them. We're utilizing them for our clients. They are a phenomenal tool when used properly, just like anything else out there. When done safely and done properly with a strategy, and we'll walk you through it. We'll
100%.
kind of give you away. We'll pull back the screen. We'll show you what we're doing there. And then another topic, it's gaining speed and momentum. Hopefully we'll have time for this one. And this is the connection between mast cells, or mast cell activation syndrome, and maybe some of the not so obvious symptoms.
Right. And from somebody who's struggled with this recently, it's even it's crazy, and I'll kind of tie in a little bit when we get there of like what I've recognized in the last even 6 months of my life. Personally, that I've been like, whoa, this is really interesting how I didn't even realize my body being in this state caused my mind to be so not connected.
I'm so excited for that conversation, because way too often, and we've been doing this for a while, we have patients that come to us and they say, I think I'm going crazy. Yeah. And part of it's because they're hunting for someone, please tell me what's going on. We're kind of saying they're hunting for what's wrong with me.
Right.
And it hasn't been answered. And I think today we're going to uncover some things that might give some people some mental brace. Yeah. At least an understanding. Not to say that anything's easy getting out of it, but I think sometimes just having, okay, this is what I got to deal with. And then it lets you kind of like, put your feet on the ground, be like, all right, let's hunker down and let's go get this.
And there's ways in which that we can actually take action to make things be better. And I think that's a scary thing. When you start to feel like you're crazy, you feel like there's no end in sight. And so we're going to give you the tools and give you the spaces to actually learn how there are tools and there are things that you can do to where you don't feel crazy.
Not that they're not all crazy, or that you and I are crazy, but
we all have our own crazy,
topic,
right?
Yeah. All right, well, let's dive in. There's plenty of meat on the bone here today. And all right, let's just dive in. First one we're going to talk about is there's, at least on Instagram, my wife brought it to my attention, and she said, is this true? Are they lowering the blood pressure standards down to 130/70? And I want you to fill in the details with the science here, and then I've got a lot to say on this one.
Yeah. So there's a couple things that, I think the social media side of stuff, I think one of them that we did see was like, they're trying to say it's going to be 110/60, which I don't think they're there yet, but I think there is a trend. And so a little bit of like the knowledge that we do have, that we do know is true. Back in 2017 is when they actually did lower it a little bit more. So we say 120/80 is like your perfect standard. Then now come 2017, they said, okay, maybe it's 130/70. And that's where those numbers started to shift. And so it's essentially taking the normal and tightening a little bit, but also playing into understanding that, diastolic blood pressure versus like the other ones that are around, like we can have different numbers there. And so I think the biggest question when it comes to this is, again, over half of the US adults have high blood pressure. And now we're going to start to lower it to a threshold where, I'm going to be even honest, sometimes I go into the doctors and I'm not even at the 120/80 or whatever, the perfect is. So the thought of going to 110/70 or even having the 130/70, you're putting a whole other group of people into that space.
Millions of people, not a small group. Millions.
And so what actually is kind of new to all of this, come last year, it was another kind of update that they were bringing in to potentially say, we might need to change the guidance to be a little bit more aggressive about acting earlier. And that's where this conversation is starting to turn. So as of right now, our normal is still, the 120/80 as of now. But there's been a lot of conversation in the last few years about changing it because ideal is under 120.
Yeah.
And ideal is under 80. And so we're starting to say, 130 is high. So it's like, we'll change that number, but we're going to drop that bottom number. You're going to catch way more people in that space. So the new guidance essentially is just leans harder towards getting people down to that ideal. And I don't know if I love it.
Yeah, I don't love it whatsoever, and I'm going to share a couple thoughts on this. And so I'm going to take this in two different directions. First, this is the part I love about what we're able to do here on the Health Hub is have these conversations and break it down from a different angle, from a different perspective. And the different language and different angles for this is this. Listen, let's stop playing whack-a-mole healthcare.
Right.
If just because something's high doesn't mean we have to push it low. The better question, and the beauty is probably most of our listeners here today are thinking in the back of their minds, well, maybe not blood pressure, but in the back of their minds, what is the root cause? So I'm going to break it down most simple I possibly can. In some of this, some of you might want to beat me up on this. And listen, there's a comment section below. Have at it.
Oh, yeah.
We will address your comments next week. But I want to walk you through how simplistic it is. I'm going to start with this, a very bold statement. I do a lot of things in clinic, as do you do. Blood pressure is one of the simplest things to fix.
Yep.
It's one of the simplest things, and maybe one of the most important. Because the leading cause of death in our country is heart disease. So to get it corrected is important. Now, with that being said, I'm going to walk you through my path of understanding blood pressure, both from a perspective of schooling and clinical observation. So when I was in school, the normal range was 100 to 140 for systolic, and it was 60 to 90 for diastolic. Now, so you can better understand these numbers, and this is going to be really important. That was normal. So they did not consider medication until you're over 140. And just saying there's one number would mean that all of us had to be the same.
Right.
We're not the same. So that's why there's a range. So 100 to 140, you're fine. Over 140, they considered it high. Now what it looks like is they're dropping this.
Correct.
And that's where it gets really interesting. That's the aggressiveness.
The window gets smaller.
The window gets smaller. I want to go to the most fundamental question that has to be asked here before we even start playing whack-a-mole healthcare. What is the purpose of blood flow? This is the question that has to be answered, and I'm going to answer this for us. And there's different definitions, but this is how simple it is. Our blood supplies the rest of the tissues, organs, and glands, including your brain, with oxygen, nutrients, hormones. And so it supplies all those tissue, organs, and glands with what it needs to rebuild, recover, and repair. The second part of that is it removes. So it adds nutrients, removes toxins. That is the purpose of blood flow. And if we all use that as a basic, generic definition, then you have to ask the question, if your body is raising its blood pressure and its job is to bring nutrients, oxygen, hormones to the tissue, cells, organs to repair, what happens if you lower them artificially?
Right.
Are you going to repair your tissues, the endothelial lining? No, that's oxidation.
Right.
So there's a chance, and again, this is where I'm going to get beat up a little bit. There's a chance by lowering everyone's blood pressure, we are actually pushing them a little closer to their grave than they need to be because we're inhibiting the potential to get all these nutrients to the body. All right, that was just step one here. The systolic and the diastolic, to your point, you said sometimes your blood pressure will be higher.
Right.
There's something called white coat syndrome.
Right. 100%.
Which most people that are on blood pressure medications have experienced white coat syndrome. What does that mean? They've gone to the doctor, white coat, stethoscope, and while they're in their office, they're nervous. They're taking a test. Fluorescent lighting, square room, little tight thing. Doctor walks in, takes your blood pressure. You're being scored. Either you're healthy or you're not. And in that moment, your blood pressure goes up.
Right.
Again, so for simplistic understanding here, systolic, this is how I kind of teach my patients. Think of it as stress in situation, so the S's.
Yep.
And that means that when you have high stress, your systolic will tighten down. Systolic measures when your heart squeezes. It measures how much pressure is in that artery.
Yep.
That's when the heart pumps. When it releases is diastolic. So the way clinically I've always approached this is your systolic is very situational.
100%.
How much caffeine? What was your workout like? How much rest did you get last night? Callie, someone like yourself, you're committed to your workouts. You're going to get up and exercise every day, right? Does it matter if you got 5.5 or 7.5 hours of sleep?
Tragically, no.
No, I know. I hear you. Right?
It should. Some days
do
more
what
than
I say,
others.
not what I do, right?
For sure. For sure, I'm getting better about it. But yeah, you know.
So that will affect your systolic blood pressure.
100%.
Because those arteries are going to, when your heart is pumping, it's under stress because it hasn't recovered last night.
100%.
And you put it under double stress. So that's situational and it's stress. So yeah, if we measure your blood pressure in the acute situation, wouldn't surprise me. A healthy, fit girl like you might be 135, 145.
Yeah.
And if you are getting tested in that moment, fear module.
100%.
Boom.
You need medicine.
Whack it.
Yep.
Whack it low. It's high, so let's whack it low. Now let's talk about diastolic for a moment. This is the one typically in the clinic, we look at it as a little bit more of a
Yep.
This is the one that shows us a little bit more about the longevity of what's taking place on a day-to-day basis in terms of inflammation in the body. This will then should open up our eyes. So if your diastolic is starting to creep up, it's 95, it's gotten to 100, 105. It's not as easy to push this low. For example, systolic, we could sit down right now, take our blood pressure, do a couple breathing exercises, long, slow exhales. And everyone listening to this, we could drop your systolic 10, 15, 20 points within the first minute.
For sure.
Very typical.
For sure.
Diastolic won't move that fast.
No.
Diastolic is more indicative of what's been going on over a long period of time. And when we see that high, for me, first thing I'm thinking, does this person have insulin resistance? Is this an inflamed chronic state where the arteries are under pressure? When the body releases, it's not.
Right.
But it also could be just chronic stress.
Right.
So how many people have gone through tragic things in their lives? They've gone through divorces, 3, 4, 5 years. They've gone through job changes. Then they get measured because they feel like crap. They go to the doctor. What does the doctor do? First thing they check.
Blood pressure.
And then they go, oh, you have a blood pressure problem. That wasn't the root problem of anything.
Correct.
Yeah. So
Yeah.
I know I rambled a little bit there.
It's a good point. It's good points though to make, because I think so many people get so caught up in the misunderstanding of what their blood pressure is actually trying to tell them. And also not recognizing that just because, a couple numbers could be a little bit elevated, take it as a smoke alarm, not a fire. And I think if we utilize, sleep, stress, electrolytes, and the way that's going, movement, insulin, all of the things that we know that can be helpful to the human body to help lower it, what if we did that first and said, oh, we can fan the smoke alarm before the fire gets here, of saying, oh, now here's a pill that you have to take. Try to use these other modalities that are out there that can say, hey, this is all real part of the story that is happening in your body. And two, if the numbers get tighter, more people are going to be in more fear of what their numbers are going to do. And for me, it would drive it up. I personally know that. So it's like understanding the impacts when you step into that doctor's office of like what you actually can do. Ask for 3 times for your blood pressure to be taken. Don't let them just fail out. Do 1. ask for the third. Like, use yourself as the advocate in those offices, because if you know that you've been under a season of stress, sugar, not recovering, all of the things that could be happening, odds are it's not that your body's failing you. It's just external things that are coming in that we know that we can reverse.
Yeah, and I'm going to go one step farther, not to try to beat up on any practitioners, but if your practitioner is not having the conversation about your lifestyle, specifically, where are your stress levels? What does your diet look like? And they're not measuring those other markers. Probably not the best advocate for your overall health.
Right.
They may be a great advocate for whack-a-mole healthcare. And I'm joking about that. And sometimes, yes, you got to whack it down a little bit.
Yeah.
Yeah. In the big picture, it achieves nothing over the long haul. Here's an interesting little study that I came across. And this is always puzzling me. And I'm going to share this insight with our audience. I've been practicing for a fair amount of time here. And what I've typically seen with my elder patients, 60s, 70s, a little bit older, and I'm getting there. So I'm saying that gently. Yet, what I've seen is that the blood pressure medications it's almost across the board. You're 60 plus, you're going on blood pressure medication over time. I know why clinically, because there's a deficiency and there's a toxicity that's not being addressed. Yet once they go on one medication, very common that they're going to go on a second one. And different medications apply and do different things. Some work on the vessel itself by relaxing. Some work on the sodium, potassium pump in the kidneys, different things. Yet here's the interesting data point. It's an observational study, 8,000 people, 7,000 people, that for the elderly, if their blood pressures were driven below 130/80, it increased their mortality rate. This goes to my original point, folks. And I'm not telling you to come off your medications, but I'm telling you, look closely.
Yeah.
Are you paying attention to root cause medicine? And when someone says to me, this oftentimes, and I'm not allowed to do this, but oftentimes I want to headbutt people.
Yeah.
But I'm not allowed to do that. When they say, or their doctor tells them, well, your dad and your grandpa and the neighbor next door and your dog, they all have high blood pressure, so therefore you do too, folks. This is not one of those things that you can inherit genes. There's not one specific high blood pressure gene, but you can inherit lifestyle.
For sure.
And it's, as we always say, that the genes kind of load the gun, the lifestyle pulls the trigger. Yep. And so, again, here with blood pressure, I think it's clinically one of the easier things to address and get great benefits from. Your point of the breathing.
Right.
One of the exercises that we have with all the patients, if they have high blood pressure, one, we get them to go down to like CVS or something and get themselves a home blood pressure cuff.
Yep.
Get that cuff. Go home, sit down. You're not allowed to look at the score. So I'm going to walk them through this.
Yeah, I love it.
This is practical. This is a little meat on the bone. So if you've ever been diagnosed or you're wondering about your blood pressure, go get yourself a cuff, go home, take your blood pressure. But you're not allowed to look at the score. Have your spouse, your wife, your kid, someone's looking at it and marking it down. In between each episode, you pause for about a minute. You're going to do it 3 times. And in there, you're going to do some big, deep breaths in through the nose, long, slow exhales, almost so you're bored.
Yeah.
And you're not paying attention. You do it 3 times in the morning. Do it again 3 times in the evening. So you start to see the state of your body in different phases of your life.
Yeah.
And I promise you, what you're going to discover is that you have a lot more control over your blood pressure than you originally thought you did.
100%. 100%. Yeah. It goes to the question, if they've lowered these numbers and they're talking about lowering it, and it's turned Americans overnight into patients, over half of Americans overnight, better medicine or bigger customer base?
All right, if I'm just trying to give them a little bit of benefit of doubt, I'll say, okay, they're trying to look out for Americans.
Right.
And they're going to say high blood pressure over long periods of time is clearly not good. But I'm a little cynic of that.
Yeah.
So I don't follow that being the best thing. The reason being is that I do not see the education coming with it.
For sure.
I do not see the awareness coming with it. I do not. I'll give an example of the technique that's supposed to be that we've both learned in school. You come into an office, you sit down calmly and quietly for a minimum of 5 minutes before your blood pressure's taken. Yeah. No speaking, no moving. Doctors aren't with you for 5 minutes, right? There maybe the whole visit is, but that is supposed to be a time. I know when I've gone, and I'm always paying attention how quickly from the way when they walk through the door, they take my blood pressure. It's within seconds.
Right, and they have you stand up from the chair you've been sitting in. You go back to a room. A nurse has a cuff on you in 60 seconds. The down and up.
The technique
is even there, so. Yeah.
So
I think the biggest is just be advocates. Yeah. Learn your body, learn yourself, and know that you are not destined to be stuck on a pill for the rest of your life. There's habits, there's things you can do, and you also can say, hey, can we take my pressure a couple times before you actually take my official number that's on the screen.
Yeah, I agree. Yeah, all right, so let's move.
From one gold standard to another gold standard,
to another
right?
gold standard, right. And there's big ones. So we've always been told that the gold standard for colonoscopies for colon cancer is to go get yourself a colonoscopy. Yep. Everyone, I think, believes this to be true.
For sure.
And that starts at 40, probably typically recommended around 50 years old. And yet the data is suggesting something different, isn't it?
Yeah, it's an interesting study. So I'm going to read a little bit about it so I don't butcher any of it. But there was a 13-year ICC trial that was a large randomized test. So it was not, had many manipulations to it. And the studies observationally over all of the years were saying that colonoscopies cut cancer cases and death. But they were observational, not fully randomized. And so the actual numbers say it's a little bit different. Observational studies were saying 50 to 60% of people who got colonoscopies cut cancer cases. These 13-year randomized tests said actually colonoscopies reduce cancer cases only by maybe 18%.
Okay, so
that's a 50 to 60 to now 18%.
Okay.
And this matters among people who actually are, completing these, because cancer risk, they are saying have dropped a little bit in it. But the big difference here is in the sense of what are colonoscopies actually doing for the body? And a lot of people out there are saying, and a little bit of what this study was saying, that just because we're catching it and detecting it doesn't actually mean that we're lowering the risk of it. Because if you have a polyp in there and we remove it, but that was a precancerous polyp, you've now allowed tissue cells to potentially spread. So we're now detecting it, but we're not actually being able to reverse it and say, oh, this prevented it. Mm-hmm. Where you're saying, oh, this is detecting it, but what if the colonoscopies actually have a higher risk of maybe even being a potential cause to it? And so they're going into a couple places with this study. I mean, it's not saying to skip it by any means and listen to your body and the people you have around you. And they didn't talk about deaths, so I'm not going to go into that space of it. Crazy thing is saying we are going from 50 to 60% to 18%.
I think that's significant because if you're doing a screening and you're thinking, well, I'm doing something really good for myself today. Right. I'm going to go in and get my colon evaluated, and if they find it to be clear, then you're thinking 60% of the time I'm crystal clear, rock on. This is where the distinction of prevention and screening are two different things.
For sure.
This is where I think there's a big problem.
100%. And two, I think the debate comes in is, are colonoscopies much better for you than easier testing that we can do, like stool analysis that are way less invasive? This is where my brain starts to go, because if we're going preventative, why are we putting people through these intense preps, going in with machinery to disrupting the environment, where we can just also ask people just to poop, collect it, and test it, and learn some of a lot of similarities there.
Yeah, and I think the big nuance there is that these are two different things.
Yeah.
And so the idea of gut health is very important.
For sure.
Crystal clear. Banking on or kind of, hanging your hope on the fact that you do a colonoscopy every 10 years and think you have good gut health, that's a problem.
For sure.
And I think that to some degree, that has been the gold standard. Saying, oh, you'll find out if you actually have an issue with your gut by going to get a colonoscopy. And now we're saying that that's not even close to the truth here. So especially if it's only 18%, that's not really good odds. I didn't know it was that low. That's wild. Yeah. And so really, what does it mean to us? And you're listening to a podcast like this because you're looking at what can I incorporate in my life that then adds up to me having the potential and possibility of not only preventing things, but thriving. And you and I know we've talked about this a lot. One of my favorite tests we're running these last couple of years is a stool sample for a gut to understand the microbiome, understand the bad guys that are there, the good guys that are there. Are there toxins hanging out? Do you have H. pylori? There's so much data we can extract from that. And especially because now we're crystal clear that there's a gut-brain connection.
For sure.
And it's how your mood, your anxiety, your depression, all of this stuff is related. So I think when I first saw that studies, not to confuse the colonoscopy with actually a health action.
Correct.
It is simply a screening. It is simply taking your blood pressure for that day. And again, this will have a lot of influence. Well, it'll be influenced a lot by who your team is.
Right.
who your provider is, who's recommending those. Do we use screenings? Of course we do. We put it in the pool of data, and then we say, well, what does this mean in the big picture? What actions can we extract from these things? And I think with the colonoscopy, what we didn't touch on, and we can if you want, but is there any potential of doing a colonoscopy and disrupting microbiome or damaging that very, very, very fragile endothelial lining inside the gut?
100%. And that was kind of the little piece I was saying. If someone goes in and has a polyp and they're trying to remove it, or even if the screening tool just goes in and nicks you, you've now damaged a lining, you've put inflammation there, and we know that inflammation drives cells that are damaged to come to a space. It creates oxidative stress in the area. And if we don't have the proper nutrients and tools, and we are toxins that are coming through, we're now setting ourselves up for disaster. I think of it all the time as like a cut, right? If you get a paper cut on your finger, it's a small cut. Those things hurt though. They're not good. And if you are exposed to potentially bacteria or anything, that little tiny paper cut, although it's small, can get infected and can turn into something. And I think the same thing goes in the senses of, biopsies, these colonoscopy screenings of removing things or nicking you. Although it's a small nick and they're like, oh, sorry, we nicked you while we were in there, we're still all of our toxins, or not all of them, but a lot of our toxins through the colon. So then what else could be happening? And I think is the big conversation.
Yeah, one of my favorite things to do is to ask when a patient comes in or client comes in and they have these tests, and I'll ask them, well, what was your takeaway? What did your doctor tell you to do? And polyps is a big one.
Yep.
So, and I see a lot of, entrepreneurs and guys that are 50, 60 years old, women too, and they come in, and then I ask them, what did your doctor tell you to do now that you've discovered you have a polyp? You know what the typical answer is? Let's check it again.
Yep.
A couple years. Nothing about, so sometimes they'll be told not to eat red meat anymore. I don't see the correlation there, not whatsoever, but that's the fascinating thing. And again, I think for the most part, this audience listening to this is going to recognize that that's not a very proactive. Are we saying don't get screening? We're not saying that. Not whatsoever.
Yeah.
We're not. At least not on microphone, we're not saying that. I'm just kidding. We're not saying that. We're not saying that screenings don't have a time and a place, but to pretend that they actually are having a role in your overall health, they are not. They are not a health action. Health action is figure out the status of your gut, put real clean, good clean food in it. Make sure that what's moving through there isn't beating up the epithelial line, isn't beating up the gut lining. Listen, if you take antibiotics, there's time and place for antibiotics. You're breaking down your microbiome.
Yep.
There's not I needed to take it and it doesn't break it down. It does.
Right.
And these are usually the precursors of what's causing or creating the opportunity for these polyps to happen, the inflammation, the tightening of the vessels in there. It's all smooth muscle.
100%.
Very much like the arteries. We're just talking about blood pressure.
The heart, yeah.
Yeah, just quick note on that. Those are all smooth muscle. They're different than the muscles that we flex our arms and our legs. The difference there is they're on part of the autonomic nervous system. They're associated with the state of being more so than intention. So when you're under stress, your blood pressure goes up and your motility in your gut goes down. Your large and small intestine actually contract. Now things stick in there.
Yep.
And that's then when we're talking that conversation, that's a health conversation.
100%. And I think another nuanced side to this is, these have been out for about 75 years now. Why did it take 75 years for us to then test this gold standard? I think that's just where my brain is like, this is the first real randomized trial on colonoscopies, yet they are the gold standard for screening for something like this.
I have a kind of a side note to that, what I think it is. I think it's very simple. Let's set aside colonoscopies for a moment. Science takes time.
Yeah.
It really does. And so whether we're talking about GLPs in a moment, we're talking about COVID vaccine safety and efficacy, it takes time.
Yeah.
And in science, the truth is that the more questions we ask, that's science. To believe it and leave it, that is pseudoscience.
Yeah.
And many of the things that we have in the healthcare system right now has been believe it and leave it.
Yeah.
And don't ask the questions. We are in an environment right now, and I really, this is the conversation I love having with people. I think that this past 8 years, so I'm rolling up on almost 30 years in practice, and this past 8 years have been significant.
For sure.
Meaning that there has been more headway made on all levels. So we've always had nutrition. So don't get me wrong. Like we've always thought, eat the real good foods. But now we have data and science that is proving it on a cellular level. So what that means is we can speed track it. We can get really sniper-esque what's good for the human body. And then we slide that over to vitamins, minerals, nutrients, herbs, all the same thing. The data is catching up. The science is advancing us. Then moving into peptides and hormone optimization. I think right now it's one of the most exciting times ever. If you are a person of action and you're taking action for your health, it's never been better. And on the flip side of that, there's still no one magic pill.
Right.
You have to be literally taking massive action. But if you do, it is so pinpointed now. So like when we sit down with someone, work with them, we take this big, holy moly million things and make it very personable for them, for who and what they are. So to your question of why does it take this long, I think it's a science thing. Science always lags 10 or 20 years.
Yeah. 100%. And I think it also gives people more of an idea of like, just because it's gold standards and it's a supposed to doesn't mean you have to. And again, not to say that like you don't need to be screened, but be aware, have that mindset. If you know that you have done stool tests and you've optimized your gut microbiome, maybe you don't go get your colonoscopy every 2 years or what, the recommendation I think is every 5, but maybe it looks a little bit different. Or you just have this awareness and the knowledge in your mind of understanding that it's not the preventative action that's actually going to prevent you from having cancer is by doing this. It's going to tell you whether you do or you don't. It's a test that's checking for a result, but it's not your preventative action to actually prevent the cancer.
Heck, I think if you want a really good night's sleep, go take a microbiome test of your gut, fix it up, do a post one, take all the actions that are recommended, and then get a good one in response. Like you fix it, that's a good night's sleep.
It is.
Yeah, if you have your microbiome.
I think we both have been there before.
Yeah, been there, that's good night's sleep.
Oh, yeah.
All right, let's shift gears a little bit. Another great and important conversation. I don't think this one's going going away anytime soon. This leads into the conversation of time frames, of science, all of this, and this is the GLPs and muscle loss. So I don't know if it's a real question anymore right now, but I'm gonna pass this over to you. There's still some debate about is there a muscle loss component to GLP use? What do we need to take away from this? And then, like I said at the beginning of the show, we'll break down for them the program that we utilize and why it's so different, and we can hopefully or oftentimes eliminate a lot of the bad side effects that take place.
100%. So we do know now that if you're going to be losing weight while being on a GLP, some of that weight will be muscle. That is not an if statement, that is a win. It is not saying it could happen, it will happen. Now, again, same thing we tell clients, there's a whole proportionally direction between muscle loss and fat loss. Typically, for about 10% of the weight, maybe about, if you're losing X amount of weight, 10% of it may be in that muscle space. You lose 10 pounds, 1 pound of it may be muscle. That's like the ideal of what you're looking for. So now we're saying, okay, like most weight loss, rather than saying this drug is selectively just attacking the muscle, the question is, who now is coming across with sarcopenia, dangerously low muscle? And so from my perspective and everything that we've talked about this a little bit, but the adequacy of nutrition that is coming into the daily intake of what people on these drugs are doing is really, really low. And so that's the area that we have to talk about. We can't just say, oh yeah, you take this shot, you're bound to lose all of this muscle. The question is, who's at the risk of losing the dangerous amounts, and how do we actually protect it? And so that's how we can go into the conversation of what we do, because being a dietitian, my first and foremost thing is I make sure that people are consuming food at least 3 times a day. People look at me, they're like, I only consume food twice in a day before these. And I said, I do not care. Because the amount that you are consuming, because you have this tool that's slowing down your motility, breaking things down a little bit quicker in your body, you have to make sure you're staying on top of that intake. And alongside it is the resistance training. And those are 2 pieces to the puzzle, and we'll get way into it, that we have to talk about, because a lot of time women think muscle is just aesthetics, or even men, but it's your metabolic health. It's your glucose disposal. It is what prevents you from being a fall risk, longevity. All of these things matter. So all your protein and our exercise is super, super important. And so now we get to talk about who's the most at risk. And it's people who are a little bit older. And when I say a little bit older, I'm not saying like you're my 60, 70 years old.
Yeah.
No, I'm saying even my 35 plus. Because at 35 or so, your body is no longer really developing your bone health as much anymore. It's hit this kind of max. Your muscle then now is what's supporting your bones. And if you're at that age where you're tipping over into your bones not being able to build as much anymore, and we know your muscle's protecting it, and you're starting to lose that muscle, then you're losing your bones as well. And that's where we have to run into saying the people who don't strength train, who are under eating, but also understand your age plays a factor in this as well.
Yeah, and again, I think I'll start by just saying we got to continue to remind ourselves that skinny doesn't mean healthy.
100%.
And I understand if everyone wants to lose a couple of weights to look better, move better, and think and see themselves better. I'm comfortable with that. How we're doing it though, to our last conversation about the colonoscopy, and you said, why did it take 13 years? I think we're going to come back in about 10 years from today and look back and be like, why did we let everyone lose that much weight that fast?
Right. Why did we give the dosings that we did?
Why did we
people?
give the dosings?
Yeah.
We are 100% like, let's timestamp this sucker here. We're going to come back in 10 years from today and say, wow, we made a mistake. And right now, when we incorporate GLPs, it's almost always microdosing.
Yep.
And we're going to find that moving forward is the way to go. Yep. Remember, these aren't new. They were used in the past for diabetes, et cetera.
Sure.
Yet the moving forward, anything other than a microdose is probably going to be considered old, antiquated, and outdated data. We're already seeing it now. We're only a couple of years into this.
Right.
So that's a very important market or important component to understand, that skinny does not necessarily mean healthy. And as we move forward, if you are losing the muscle, you're getting older. That's it. I'm going to tell you right now, as a 50-plus-year-old something, the number one thing moving forward is muscle mass. My ability to move, to pick up my dogs, to do whatever it is. And if I was to lose this muscle mass, then all of a sudden the aging comes. And we know that. We call that sarcopenia. So I'll walk you guys through what Callie and I do for some of in our program. And this is what I would say. If you're not currently doing it, go talk to your provider about doing these. Is that fair? And I'm not knocking them. Yet you have to look out for yourself. There's a couple very specific things here, especially the last one, so listen closely. So Callie mentioned a couple. Number one, specific to you in your muscle mass, it means we have to be able to somehow measure your metabolic health. We have a machine, but a lot of machines all around the country that help you understand how much muscle you currently have on your body. Body fat percentages, skeletal muscle mass, have some measurement. Somewhere in where you live, there's somebody that has a tool. And then there's like the home units. I think they cost like $100 now.
Hume, I think, is one. Yeah.
No,
there's a lot of home ones.
There's a lot of good ones. You want to know where you start, because if you don't, then all of a sudden one day you wake up, well, I think I still have muscle. I look skinny. And that's not true. So number one, measuring muscle mass. Number two, based on your muscle mass, and this is where it gets very specific, we give you a number of grams of protein per day to shoot for. Just yesterday, I had one of our clients come to me and said, this is very interesting. I think I need to come off of this. I'm not hungry, period. She's always been a weightlifter, and she's wise enough to go. She basically said, laughing, said, I know this doesn't make sense. I'm lifting weights and I'm not eating protein. I'm not hungry. She's like, I have to back off. We'll get to that in just a moment. So we have the protein, we have the measurement, and then there are some very specific labs. And I don't know anyone else doing this out there. This is very important. We're going to look back at this and again saying, why would we provide someone with something that has such... It's an inhibitor. It limits your ability to digest food. It limits your ability to desire food, and we're not measuring the outcomes. A CBC, so we've got to have a complete metabolic panel. Then we also need B12 and folate, iron, and ferritin. Why are these important? And I'm just going to keep this simple. Folks, B12 is the major driver of your mitochondria. And we're not talking about supplementing. We're talking about your ability to consume it through beef, through salmon, through eggs, get it into your body, then digest it. This is the problem, folks. We've slowed digestion. We've slowed down gastric emptying, which means that your pH is changing. Your ability to absorb B12 is declining. Now, put this math together. B12 only happens in a very acidic pH, and you're no longer going there. You're eating less of it, and you're going to think long-term this is good for your mitochondria.
Right.
No, folks, it's not.
Right.
And this is the beauty of this environment. We know these things.
100%.
These are incredible tools for us to use to maximize our health and our potential. So that's why having these labs measured, how often? Every 3 to 4 months.
Yep.
Our bodies change. Yes, a little inconvenient. And yet that is part of gaining optimal health, is understanding there's going to be, to be healthy, it is going to be a little bit inconvenient, uncomfortable, unfamiliar on a regular basis. But this protects you from the things like, we've seen people with like eye loss, like
blindness.
Yep. We've seen people with the Ozempic face. Is that what they called it? The lack of collagen in their skin.
Yep.
We see every day, and this is an ongoing one. We see the lack of desires. Food is the greatest human desire that we were born with. It's an innate intelligence. It tells us desire food so you can live. So you go down the road or you go hunting and get a cow or whatever it is. You probably don't hunt cow, but nonetheless, you get my point. The desire to have food in the human body is part of survival.
Yes.
We're losing this. Then after that, of those survivals, then we start to lose some of the fundamentals.
Yeah.
Libido,
100%.
excitement, creativity. These are real. How do I know? If I told you how many husbands I've had come to me and say, Doc, my wife, she's skinny, good for her. She's lost her libido. Mm-hmm. She's lost her hair. Now what?
Right.
So these are real things and preventable. If you wait for science to show you and tell you this, you got 10 years, it's going to be a hard lesson. There's ways to do this prior to that.
100%. And
right.
Go ahead.
Yeah, one more I want to talk
Keep
about.
going.
And I think this is a big one. You and I have talked about this a lot. If you're going to add something into your life, I don't care if it's a supplement, running, whatever it may be. Let's just talk about vitamins, herbs, supplements, peptides, and hormones. You always want to understand what is your on-ramp and your off-ramp.
Yes.
And what that means is this. If you take a vitamin and supplement, for the most part, you should be able to come on them and off them. No big deal.
Yep.
No big deal. No, your body's not, especially if it's a whole food supplement, your body shouldn't be in withdrawal or anything like that. If you go on a peptide, for the most part, let's extract the GLPs for a moment. Let's talk about like Somorelin or BPC 157, all of those other ones. You can go on it, off ramp, come off of it, no big deal.
Right.
The body's not going to have a withdrawal phase. GLPs, a little bit different.
Yeah.
They are slowing down the food noise. But you haven't necessarily practiced how to have that reduction by yourself.
Correct.
So this process here, the on and off ramp, becomes very important that you have that conversation with your team, your health team. That's a big part of when Callie and I are sitting down with people, we talk about, okay, we're going to put you on this for a period of time.
Yep.
We'll help you with this program. And let's discuss the off ramp.
Yes.
Is this just a forever and ever? And we're going to discover the answer is no. And it can't be. You can't be on a starvation diet forever.
Correct.
It doesn't work that way.
You're not going to feel well.
Yeah, you cannot limit your caloric intake forever.
Right.
So what is the off ramp? Early on, we're discovering that we're not only people gaining the weight back, more. And so we have strategies that we put in play for individuals in terms of the on and off ramp. And again, I'll go through those. Your protein content, body composition, your lab tests, and your on and off ramp. If you're not discussing those with your docs, you start to have that conversation or find someone that will have that with you.
100%. Yeah. And just being mindful too, I think you mentioned it, but it's just the mindfulness of the amount that you're on. You know, if someone's ramping you up to a higher dose, your off ramp's going to be a little bit slower to titrate off of it. But it goes back to what I said at the beginning as well. Do not let the food noise drown out your action. And I want that to be something that I drive home to so many people, because I have seen gastroparesis develop in people because they stopped eating. And so that is where the biggest piece is, you know, when we talk about your protein intake that you're consuming, you have to let something, AKA food, touch your GI system 3 times a day.
So for clarity here, what you're saying in this scenario, when you're using this tool, the person might not be hungry, and you're saying you got to eat anyways.
100%. And if that means you set a timer on your phone to remind you at 9 o'clock, at 12 o'clock, and at 4 o'clock, you put something in your body, you have to do it. The goal of all of this is not to say we want to never eat again. Because again, your body is not going to adapt to that. Back to the person that ran into you yesterday saying, I got to come off because I'm not hungry. If she had practiced at the beginning, utilizing 3 times a day of some form of consumption, her off-ramp's going to be a lot easier because she hasn't fully let herself go from not being able to eat at all. And so if you have that, those are the habits that we also want to talk about when you have that off ramp, that you don't gain all this weight back. If you start exercising and you're eating good quality protein 3 times a day, you're setting yourself up for success when you come off of these things, because again, they're not to be on forever. And now some people, health-wise may have to be diabetics and all of that. So we're not going to say like those people aren't. But if we're using this as a tool, it's a tool, it's not your fix. And so we have to say, what are the other tools in our tool belt that we utilize with this to make sure that we are staying successful long-term? And so those are our big kind of pieces to this puzzle. But if you are on one of these things right now, lift some weights and consume something at least 3 times a day. And I'm not saying just like a bite of chicken. I'm saying an actual adequate protein proportion for each time you're eating. And that will help you tenfold. We talked about the hair loss aspect of it last week and how protein is to your hair. So many people are talking about hair loss right now with it, just as much as the muscle loss. And so that's going to help prevent that hair loss. Like, there's so many benefits to what these are doing. You just have to work with them. You can't work against them.
Exactly said that way. So with that being said, folks, I want to remind everyone that if you would like to work with either Callie or myself, and especially topics like this morning or this afternoon, we just covered blood pressure. This is a common thing that many people listening to this, you or someone you know have been diagnosed with high blood pressure. Maybe you're sitting there like, if I've been on these things, and it's not our goal to get you off, but do I have an option?
Right.
Of other options? The answer is yes. So whether it be blood pressure or colonoscopies and your gut health, or how do you utilize a GLP, maybe you're concerned of one. I see a lot of that right now. A lot of people concerned of, they want to utilize it as a tool, but they don't know how to. So if that's something you want to do, whether it's with myself or with Callie, very simple. I'm going to make sure there's going to be a link in the bio below.
Yes, in our
link in the bio
description,
below,
yes.
and we will take everything. So to give you an idea for this, everything about you, your history, your past, what you are doing, what you're not doing, all of these things will be in a conversation, a personal one-on-one conversation, and then we extract from there. If you have old labs, we'll take your labs. If we need new labs, we'll get new labs. We will figure out strategies for you, how you move, how you eat, and also some of the ways that you think about your personal health. So that link will be in the bio.
Yes.
All right, let's push forward to this other conversation, which I think is a growing nonstop just topic out there. I see it more and more on social media, and this is the conversation about, listen, it's not all in your head. This might be in your immune system. Specifically, it might be involved with something that's called mast cell activation syndrome, or what they abbreviate as MCAS.
Yep. This piece to it all just makes me so excited to talk about, because like I mentioned earlier, it's something that I've dealt with personally. So I know a lot about this. But there was a new research that's come out with mast cell activation syndrome patients, I guess we're going to call them. And it found that significantly elevated rates of neurological and psychiatric conditions such as fatigue, cognitive dysfunction, what we like to call brain fog, migraines, anxiety, and depression are some of the things that fall in suit with people who have MCAS. The big takeaway is that mast cell dysregulation appears to affect the brain and the nervous system, not just what I experienced or thought I was experiencing in my gut and in my skin. And so it's been such a unique kind of tool, and this is just a little piece for me to segue in the personal side of this, because for the last few years, it's been a piece of just my story and my journey of healing my body and being exposed to a trigger. And we'll get into all of the MCAS and what it really is, but there's a lot of times that triggers that can flare up these mast cells in your body, mold being one of them, toxins. There's a lot of different things out there. You become super sensitive to a lot of stuff. You may feel like you're having literally to life. You feel like you're having allergies to everything. Your immune system then picks an area to essentially attack. A lot of times people see it in their gut and in their skin. And so this more nervous system, brain side of stuff has become more aware, in the sense of recently I've become, my skin's healed, my gut's healed, I'm feeling in a much better place, and I'm doing things around the house that I wasn't doing before. And not realizing I wasn't doing it. And my husband made a comment to me, and he was like, wait, you're actually, in a joking way, like domestic again, because I didn't have the capacity to clean my house, and he was picking up that load all the time. And I was like, I'm busy. Or, my brain feels foggy. I didn't really recognize that my whole system had been kind of convoluted by my immune cells. And so that was a piece of it. Another piece was being able to actually recognize, oh, my recovery on my Oura ring. For a while, I wasn't recovering, and I thought I was just going hard. Then I stopped going hard, and I still wasn't recovering. Now I'm at a place where my ring is like, my recovery is a crown almost every single day. Not that I've changed any of my habits, but my body is no longer in this stuck space. I didn't have all these external stressors coming at me. It was more of this internal, my body at war with itself. And I thought it was just showing up on my skin and causing me to have gut issues. And now I'm actually recognizing it impacted my home life. It impacted my relationships. It impacted the way in which my body was functioning among people and the energy levels that I had. And so when I saw this study, I was like, oh my goodness, this is me. And so many women out there, the more I've had this conversation with them, are like, whoa, that's me too.
Yeah. Inevitably, this seems to hit women more frequently than men, hands down. And what we're seeing in clinic now, it's the symptoms they're wide.
They're wide.
The classic ones are going to be the skin issues.
100%.
The flushing of the skin, the elevated heart rate, the congestion, like those are probably the classics. Yet we didn't involve until now, we're seeing, especially with the data, that this affects the brain.
Yeah.
This is affecting our psychology. This is affecting the nuances of the worry, concern, and fear of all of those other things.
Yeah.
And it creates this like paralyzing situation. And we know this because not only did you have to experience it firsthand, but we see it with our patients.
All the time.
It's almost as if you want to hug them and just say, hey, I got you, because they don't feel safe in their own environment.
100%.
On many levels. And it could be perfumes, it could be the noise. They're thinking every day about all the potential things that are going to set them off. And that is troublesome. And I think you're now on the other side of this.
Oh, yeah.
So, and I got more on that, but can we go into what potentially, let me do two things. I'm gonna share with you what I consider the three most common reasons people end up with mast cell activation syndrome. I'll define that in just a moment, but I'll see if you fit into these and if you'll even share it.
Yeah.
You don't have to. I'll put you on the spot.
Oh, no.
The most common reasons people end up in this situation is because there's a gut disruption.
100%.
Almost always it's leaky gut, but it could be the SIBO, it could be dysbiosis, but leaky gut is almost always a component of it. Second is mold.
Yep.
In both of these, just so we understand, when you have leaky gut, the stuff on the inside of your gut leaks out and your immune system bombards it.
Yep.
Nonstop. It's attacking it. So you have a nonstop immune issue. Maybe it's not getting sick all the time, but now it's an internal battle. Then with mold, same thing. Your body's trying to fend against mold 24/7. So we have this elevated immune dysregulation, frankly. Yeah. And then the third component that I see is a nervous system that's dysregulated.
Yeah.
And you could just call that stress. So if I flip that over to you, and so because I think this is valuable, what in your life, now that you're on the other side of this, not permanently out of it, because you could slip back.
For sure.
What do you think leading up to it could have been part of the causing factors?
A couple things. So I know my gut was a mess because I did test and did a stool test. But I think the things that beat it down over time was leading up to this becoming this explosion. I was a college kid. I was not eating well. I was not sleeping well. I was drinking alcohol. I was doing all the things that my body was rejecting against on a regular basis. And so I was eating high gluten, I was eating processed carbs, like all of the things that was shredding and impacting my GI lining. So the gut dysregulation, big time there. I also had 2 bouts in the time because I just ate a lot of sushi and random things of rounds of having bad stomach problems, whether it was constipation or diarrhea. And I was
parasites, right?
Correct, yeah. Which I now know were parasites in that time. But we just brush those things off, right? After you've been drinking, you might not have great stools for a couple of days and you're like, oh, that's just normal. That's not normal. So that was there. Mold, big time. Lived in a house, had a crawl space underneath the house with hardwood floors. That was an old house. All of that moisture. We had a sump pump underneath that house and it did not pull that water out. So I knew for an entire year I lived in a space, and I tell a lot of people now, if you're in a house that's relatively built in the 1900s at some point, be really mindful, because the things that they did back then were not the windows, the irrigation underneath the homes, all of that. So that was a big trigger. And nervous system wise, right? I was finishing up a master's program, starting a job, doing all of these things, moving, there was so many things, getting married. It was one hit after the next. all exciting things for me. But when I added those two other factors in with having dysregulation and then just a little bit more stress to the system, my body was like, yeah, no, we're not here for it.
And thanks for sharing that, because part of what I wanted you to share with what you just did was there was nothing bad.
Right.
Like, this was the prime of your life. Like, you're graduating college, moving on, developing your career, getting married to the man of your life, like all of these things. And then it happened during that. So it didn't necessarily have to happen with a bad episode. My wife and I lived in not an old house, a new construction house. For about 4.5 years, not knowing, and it was a cement-built house, a beautiful home, and the moisture in the cement was there nonstop, and it grew mold. And this was a good 10 years ago, and it was the toughest 4 years of our lives.
Yeah.
Didn't know the difference until we moved out.
Yep.
Unfortunately, we had some good habits, so it only took us, I say only, about a year to recover.
Mine's been 2.5, right? And
we didn't have this knowledge.
Right.
We lived through it, so there's doesn't have to be that way for everyone.
Right.
So let me go back for just a little bit. If this is a new thing to you and you've never really heard of mast cell activation syndrome, but what Callie's discussing here and the symptoms I'm sharing with you, it makes you go, wait a minute, I have some of that. I have this brain fog. I have this fatigue. And I'm talking about the fatigue that makes you just don't want to do anything.
Right.
So let me break down. So it is an immune issue at the root of it. It is not the question of like, how do I get rid of my mast cells? Because often some of the strategies is a lot of suppression in this. Suppression of histamine, suppression of mast cells. That can be part of it. What happens technically is the mast cells become degranulated. That's a fancy way of saying that over time, your mast cells are breaking down and it's going haywire. They typically do break down and they produce histamine in very responsive states. You get stung by a bee, your mast cells break down, they create an inflammatory state. That is perfectly good response of your mast cells.
Right.
That's not the syndrome. That is mast cells doing their job. Mast cell syndrome, meaning that they're dysregulated now. Yeah. Now you run into some perfume and boom, it happens. You run into a house where nobody else smells mold. The moment you walk in, you go, is there mold somewhere? It's you. That's the mast cell activation syndrome. Now your alarms are on super high. And I will tell you, this is where it gets tricky because you chase symptoms first. You chase the skin conditions, you chase the hives, you chase the brain fog, and you may have to do a little bit of work in all those categories, but getting down and being very intentional about the sequence, of how to handle these, that becomes your medicine, that becomes your answer to get out of this.
100%. And that's what I lean towards for everybody, is like there's a sequence to it. Because a lot of people now, being somebody, and I thought I was a failure at first, being in the space of what I do and having this, but our bodies are all going to respond in their own ways. And now it's actually providing me the tools to be able to give other people the insights on how this works. But if I was just going to go whack-a-mole and say, this is how I'm going to do it, and this cream's going to work, and boom, 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 it wasn't going to work. I had to get really sequential with everything that I did and the steps that took me to being here, and what I still have to continue to do as well on the other side of it. And one other little nuance that I do want to throw into all of this is we've seen a lot more of it post-COVID. And we understand, if you have done any COVID research, you understand that COVID had these spike proteins that have damaged some of our cellular impact, especially on the immune system. And so we are seeing the fact that some of that damage from the virus that not we all, but a lot of people have had, I had it a couple times, can lead to some of these mast cell activation syndrome cases that we're seeing. And so don't discredit yourself, even if you were like, I haven't never lived in a moldy house. Yeah. Or, I've tested my gut and it feels good. There's other things that can cause it. And I will say COVID was one that we've now seen this massive spike in people struggling with these inflammation type syndromes that we're dealing with. And so if a couple of the things we said didn't strike home with you, but there's other areas of your life that you're like, oh, I can correlate some of this timeline back to, then you also could, benefit from finding help.
And that's a great point. Of why now? Like, why do we see so much of it? And I agree 100%. Since COVID, we're seeing this through the roof. We've always seen mast cell activation syndrome. It's not a new diagnosis. We just didn't see that much of it, where your immune system literally goes haywire. We're seeing it so much then. And I think the first component is the continuum of stress
for sure,
for a couple of years, for all of us, regardless where you were. It was a very stressful situation for our culture, our communities, et cetera. And then the viruses. and then, dare I say, the vaccine itself.
Right.
Right. So there's all three components there that were real. So they affected just about everyone. So
and our food, right? One more thing, our food's breaking down our gut too. So it's like it all pieces it together.
Yeah. And so all of those, that being said, so if you're out there and you've been down the road and you've been to all the different practitioners and you've been told, and they kind of come up with no answers really. And they're saying, I don't know that anyone ever says it's in your head. I pray that no doctor ever says this is in your head. I just pray that. I hear that. Right. I see it online. They told me it's just in my head. I'm praying that it never happens. You'll never hear from me. I will tell you that there's a reason, and we got to find that root reason. And if that happens to be, let us know. We'd be happy to help you out here.
100%.
I love this conversation. It basically says, hey, do more stairs. Stop taking the easy route. And we've noticed that people who walk stairs more live longer, healthier, and stronger than people who don't.
Yeah. So this is not small. There was a massive study of almost 500,000 people.
Huge.
And it found that regular stair climbers had a 39% lower risk of dying from heart disease.
Boom.
Free, wildly effective intervention right there.
Yeah.
Why don't we do it more?
Yeah, so I think my answer to that is we seek so much comfort and we're encouraged to seek the easy. And there's so many lures that say, like, just take this and just do this. And to our whole conversation today, the idea of the blood pressure, the idea of the colonoscopy, the idea of properly using tools is personal action and personal self-awareness and personal desire to be the best version of ourselves. When I roll up to the grocery store and I see all of those spots and people waiting for the spots for a car to pull out so they can line up in front, that is the why to me.
Yeah.
Is because somehow we have associated if it's easier, it's better for me. And I pray that as a practitioner, I've never provided that. Even though we supply supplements and strategies, I never want to say that it's ever going to be easy. The truth is, as we age, it's harder. It's going to get harder. Whatever you're doing, whatever age you are this year, here's something to bring to the bank. Whatever you're doing this year, you got to do more and better next year. Period.
I love it.
Yes, and this studies like this is crystal clear. The people that work harder, going upstairs is easier than walking on flat ground. I'm
100%.
sorry, it's harder.
I was about to say, it's harder to go upstairs.
It's harder to walk upstairs, and we're seeing a 39% decrease in potential for heart disease. That's amazing. Like, what else do you need to know?
Right.
Go do that.
Right. And we're so willing and quick to spend all this money on these longevity things when we have the tools right at our footsteps of being able to walk up the stairs. And so that's just like what I want people to recognize as well is if you have this opportunity, and we talk about it all the time, health is never convenient. It's always inconvenient. It's uncomfortable and it's unfamiliar. And so anything that falls in the convenience, comfortable, and familiar range, I want you to challenge yourself with it. Like, that can be the empowerment where we go from post-show today, is if it feels comfortable, convenient, or familiar, maybe do the thing that's the opposite of it and see what your outcome looks like.
So, quick funny story. Yesterday, one of the ladies who comes in to see me on a regular basis, she's been away for a month, taking care of her mom in some other state. And she said, I'm way out of shape. I've lost it. And I said, well, what do you mean? She's like, well, my parents have a one level, and she's 60 or so. So her parents are pretty old. Her parents have a one-level house. And she said, so I didn't do anything. I didn't do any stairs. Literally is what she says. And I said, well, do you have a lot of stairs in there? She said, yes. And I never hear this. I hear people building homes specifically to avoid this. She's a 4-story house. Now, granted, it is on the Gulf of Mexico. It's beautiful. Gulf of America, yeah. So, and she says she loves her stairs because it forces her to stay strong every day.
I love it.
I was like, boom, right there. Yeah,
that's it.
I love it. I love it. All right, so let's wrap it up. So with all that being said here today, looking at everything we discussed, blood pressure, it's not the number, right?
No.
It is what's causing that number. Let's not play whack-a-mole there. Screening, colonoscopy, gold standards in the past. They might change as the future goes.
Right.
And I think that happens when we start asking and have better conversations like this. We start thinking a little bit different. And so I'm not saying not getting a screen.
Right.
You don't have to avoid screening, but and how do I become healthier, especially when it comes to gut? You can do a microbiome test. GLPs. This conversation will continue to unfold itself. We're trying to get you ahead of it so you don't have to be scratching your head. Well, why didn't they tell us this 10 years ago? And 10 years from today, they're going to come back and say, why'd we overdose them?
100%. Yeah. Why did we not encourage more intake? Yeah.
And then what else did we discuss here
MCAS.
today? MCAS, yes. And so if you've been looking everywhere, maybe it's time to look at just a little different place. You're not crazy. Well, you might be crazy. You might be a little bit crazy, but nonetheless, MCAS, real thing, mast cell activation syndrome. It is affecting your immune system that will affect your brain over time.
Yeah.
And last but not least, you want to be here a long period of time. Run the stairs.
Take the stairs.
Take the stairs. All right, with that being said, just a quick reminder here. If you want to work with myself or with Callie, very simple. There's going to be a link in the bio below. We can help you with pretty much everything. All the programs we've talked about here today, we will make it super specific and personal, super specific and very personal for you and your needs and your desires with your health. With that being said, we'll see you next week, and then we'll make sure that we're always paying attention to what's trending, what's timeless, and of course, what actually works.
See you guys next time.